Welcome. Every time I walk into this room, I remember what it was like 40 some odd years ago when I actually lived in this building. I'm Jack Stern, and I'm the president of your Alumni Association. I assume everyone's going to graduate, so I assume it's your Alumni Association as well. And it's my pleasure to welcome you today to a ceremony that's almost unique to Einstein. That is to hand out scrubs before you take on this almost religious exercise of going and learning on a cadaver. And I'm sure that Todd and the others will speak more about that, Harris. So the Alumni Association is pleased to sponsor this event, as we sponsor a number of other events, including stethoscope and white coat ceremony. But this is really a special ceremony because we don't invite parents. It's just the students and those of us who will spend a few minutes addressing you. And today, the people who address you are all Einstein graduates, including Todd Olson, who's an honorary Einstein alum. And those include Todd, who you will spend a great deal of time with. He's professor of anatomy and structural biology, and as I said, an honorary alumnus. Then there's Harris Goldstein, who has so many titles here that it would take me 15 minutes probably to go through them, but he is Assistant Dean for Scientific Resources, Charles Michael Chair in Autoimmune Diseases, Professor Departments of Pediatrics and Microbiology and Immunology, Director of the Einstein Montefiore Center for AIDS Research, and a graduate of class of 1980. And last, the new member of the Alumni Board, and that's Raja Flores, who is a graduate of the class of 1992, a mere 20 years ago. And Raja is Chief of Thoracic Surgery and the Ames Professor of Cardiac Thoracic Surgery at the Mount Sinai Hospital and Mount Sinai School of Medicine. So I'd like to thank those speakers who have come today. I know everyone's time is valuable. And with that, I'll hand the podium over to Todd.
All right, I want to begin by thanking the Alumni Association for making this event possible, and certain people in particular. Emily Schneider. Emily is the head of the part of the Alumni Association that has organized this, and you met them at orientation. And Karina Goldberg and Sari and Amalia and Enid are all going to participate in this, and I want to acknowledge their help. There are also going to be alumni present that are going to be actually giving you the scrubs as part of this event this evening. And I also have the pleasure to say something to you about Dr. Harris Goldstein. This whole thing was his idea. It's pretty amazing. He came up to me after one class. We'd actually, within the college, been having a sort of debate about should we or should we not have the white coat ceremony. And as you know, we did not have a white coat ceremony for many, many years. And one day after he finished lecturing and I was coming on, he came down and he was saying, "You know, Todd, we don't need a white coat ceremony. What we need to do is give the students scrubs, something they really can use that's going to be practical." And we started thinking and talking, and he thought, well, maybe the Alumni Association would be interested in that. And as a way of recognizing Harris's role in starting this event, he's always been our opening speaker for this. And it's a real pleasure and honor to have him as a colleague and as a friend and somebody who has great ideas and the follow through to make them happen. Harris?
So during the past 2 years, all of you may have asked yourself, a variation of, will I get into medical school? Will I become a physician? Do I want to be a physician? For all of you, these life-changing questions have been answered this past year. Yes, you will get into medical school. Yes, you will become a physician. And hopefully, yes, you still want to become a physician. However, now, a new critical question lies ahead of you. The answer to this question will guide your future career. Specifically, you should be asking yourself, what kind of physician will I become? Not what specialty of medicine will I practice, but what behavior will characterize my interactions with my future patients. Will I become a medical service provider or a doctor who cares? How you answer that question will likely be affected by mentors and role models you will interact with during your medical training here at Einstein. I posit that to answer this question, you should look to a unique mentor who will be teaching you anatomy. At the commencement of the anatomy course, you will all be doing something that has been done by only a minuscule fraction of the population. You will dissect an intact human body. This unique experience, the dissection of a human body, marks your transition from a student in medical school into a physician in training. It is appropriate to mark this transforming event with a ceremony, particularly one that is sponsored by the thousands of Einstein graduates who have preceded you, the members of the Albert Einstein College of Medicine Alumni Association. Now, all of you decided to become a physician because you wanted to help people. We are all usually motivated to help people for a variety of selfish, though noble reasons, including the good feeling that comes from knowing that one has made a difference. There is an exception to this. It is described in Judaism as chesed shel emet, the performance of true acts of kindness, doing a purely altruistic act for someone else while getting absolutely no benefit. A prime example of this is when one honors the request of a deceased individual who will never know what we did and cannot reciprocate for what we did for them. It is a true act of kindness that we do, that a purely altruistic act. In the anatomy course, many of you will be the beneficiaries of a purely altruistic act performed by deceased individuals who will have chosen to donate their bodies for anatomical dissections to educate future physicians about the structure of the human body. Their deed is a true act of kindness. While the deceased individual you are dissecting will assist you in your medical education and enable you to treat other individuals and save their lives, they themselves will receive no benefit. These deceased individuals who have no possibility of gaining benefit for themselves are providing you with the truest act of kindness. I ask that you consider their selfless act when you think about what kind of physician you will become. You can never directly pay back the deceased individual who will teach you human anatomy. However, you can indirectly pay them back by following their example and pledging to become the kind of physician who cares and performs altruistic acts of kindness to his or her future patients. In the future, you may debate whether to treat a socially, financially, or emotionally challenged patient. At that time, think of the true act of kindness that enabled you to transform into a physician in training and pay it back by displaying the highest level of care, compassion, and concern for this patient as well as for your future patients. It is appropriate that the Einstein Alumni Association is part of your transition today and has initiated this unique Einstein tradition of providing our students with scrubs to start your unique medical journey. All Einstein alumni have faced the same question you are now facing about what kind of physician he or she should become, and the overwhelming majority was inspired by Einstein training to become empathetic and caring physicians. You, along with students at many other medical schools, were recently initiated into the responsibilities of becoming physicians in a white coat ceremony. But Einstein is unique. No other medical school has a scrub ceremony. I would like to remind you that the respect associated with wearing a white coat, the dress uniform of physicians, is not automatic. It must be earned. In my experience, this respect is first earned while wearing scrubs, the combat fatigues of physicians. Scrubs are worn by doctors when they are at risk of dirtying their clothes while intimately involved in patient care, whether in the operating room, in the emergency room, in the wards, or in the clinic. When a patient sees a doctor in scrubs, he or she does not see any signs of rank or artificial economical or educational barriers separating them. Rather, just a doc who is willing to do anything it takes to get them better, regardless of the cost. That is the Einstein way, and why the scrub ceremony is a unique Einstein event. Einstein graduates have the we care, we can, we do approach to providing medical care. We are trained to jump into the trenches, to fight for our patients while not worrying about the consequences to us, whether in the Bronx or throughout the world. We are not afraid to get down and dirty in order to provide the best care for our patients. This approach leads to the hands-on training received during 4 years at Einstein, which has made Einstein students known for having superb clinical skills and a proactive approach to providing the best clinical care to their patients. I would like to end my talk with you by sharing a personal story. My sister Marcia graduated Einstein over 20 years ago and became a highly regarded hematopathologist. Unfortunately, 3 years ago, after a valiant battle with pancreatic cancer, Marcia died. A few years before, Marcia dramatically displayed the we care, we can, we do Einstein approach. While at work as a pathologist examining slides through her microscope, Marcia heard cries for help. She came out of her office and saw one of the senior administrators lying on the floor in a pool of vomit in total respiratory and cardiac arrest. Marcia quickly took charge, strode toward the lifeless administrator. She knelt down, cleared the vomit out of the administrator's mouth with her fingers, and gave the administrator mouth-to-mouth respiration until the ambulances arrived. In between breaths, Marcia instructed one of the pathologists standing by to administer cardiac compressions. Afterwards, Marcia called me. Instead of being proud of having saved a life, she was distraught at the thought that she had made a mistake. Although she saved the administrator's life, she was concerned that severe brain damage had occurred prior to the resuscitation that would prevent the administrator from ever waking up and leading a normal life. She kept worrying about this and visited the administrator every day. However, in a happy ending, after being on a respirator in a coma for several days, the administrator woke up and ultimately sustained a complete and full recovery. This senior administrator visited us while we were sitting Shiva for Marcia, retold the story, and expressed her gratitude to Marcia for saving her life. This experience to me exemplifies the Einstein way. Show you care, jump in, put on your virtual scrubs, take charge, and save the patient's life while always being concerned about the ultimate well-being of the patient. This is how you earn the right to experience the respect associated with wearing a white coat. In less than 4 years, you will be joining the ranks of Einstein alumni. As a member of the Einstein Alumni Association, I am happy to participate in this ceremony where we demonstrate our linkage to you by providing you with the medical fatigues to wear during your transition from a student at a medical school to a physician in training. I hope you internalize the lesson of chesed shel emet, or performance of true acts of kindness that your cadaver donor is teaching you, and combine it with the medical and social activism of we care, we can, we do that Einstein students are known for. In the future, I hope you will feel a shiver go down your spine when a grateful patient looks you in the eye, thanks you, and says, Albert Einstein would have been proud to know that you trained at a medical school named for him. I hope the mentorship of your cadaver donor will help you decide on what kind of physician you will become, and I wish you all the best of luck in your future careers.